Welcome to the NCLEX practice test for safety and infection control. This practice test consists of 40 questions that cover a variety of topics related to safety and infection control, including measures to prevent the spread of infection, safe handling of equipment, and emergency procedures. Each question comes with a correct answer and detailed explanation to help you better understand the materials. If you found this video helpful, be sure to like the video and subscribe to our channel for more resources. Let's get started. 1. Which nursing intervention is most appropriate to reduce environmental stimuli that may cause discomfort for a client? A. Loosen pressure dressings on wounds. B. Use assistance to pull a client up in bed. C. Check temperature of water used in a sponge bath. D. Position the client prone. Correct answer, C. Check temperature of water used in a sponge bath. A nurse can reduce environmental stimuli that can cause discomfort for a client through several interventions. When giving a sponge bath, the nurse can check the temperature of the bath water to ensure it is not too hot to avoid burns, nor too cold to avoid causing discomfort. Other measures the nurse can perform include lifting clients rather than pulling them up in bed, changing wet dressings, and providing proper positioning while in bed. 2. A nurse is assisting a client with shampooing his hair while he is still in bed. While helping the client, the nurse raises the bed to approximately the level of her waist. What is the rationale for this action? A. To prevent shampoo from getting into the client's eyes. B. To allow excess water to run off the edge of the bed. C. To decrease strain on the nurse's back. D. To prevent the client's hair from developing tangles. Correct answer, C. To decrease strain on the nurse's back. When assisting a client with activities of daily living in which the client remains in bed, the nurse may raise the bed to a level that is appropriate for working. This reduces strain on the nurse's back and legs when she must stand at the bedside to assist the client. 3. A patient triaged as Class 4 in a mass casualty emergency situation means that the patient A. Has life-threatening injuries but is expected to survive. B. Has minor injuries and does not need immediate attention. C. Has life-threatening injuries and is not expected to live. D. Has major injuries but can wait 45 to 60 minutes for treatment. Correct answer, C. Has life-threatening injuries and is not expected to live. A patient triaged as a Class 4 patient means that the patient is given the lowest priority because they are not expected to survive. Comfort measures can be implemented for the patient, but time and resources are not supposed to be spent on a patient who is unlikely to survive. 4. You see a patient lying on the floor of the bathroom. You are not assigned to this patient. What is the first thing that you should do? A. Get the nurse who is caring for the patient. B. Tell the nurse that the patient has had another seizure. C. Observe the patient for any injuries and call out for help. D. Nothing. This patient is not one of your assignments. Correct answer, C. Observe the patient for any injuries and call out for help. You should observe the patient for any injuries and call out for help. This is an emergency and you must act immediately even if the patient is not part of your assignment. You did not see this patient before they fell, so you do not know that the person has had a seizure. 5. You are ready to give your resident a complete bed bath. The temperature of this bath water should be which of the following? A. Cooler than a tub bath. B. Hotter than a tub bath. C. About 106 degrees. D. Over 120 degrees. Correct answer, C. About 106 degrees. The temperature of all bath and shower water should be about 106 degrees. A bath thermometer should be used to determine the temperature of all bath water to make sure that it is not too hot. Hot water can scald and burn a patient or resident. You must also be sure that the temperature is not too cool. Cool water is not comfortable for a bath or shower and it can lead to shivering and chilling. 6. The nurse should wash from the underscore when washing a patient's eye area. A. Outer canthus to the inner canthus. B. Inner canthus to the inner canthus. C. Internal nares to the external nares. D. External nares to the internal nares. Correct answer, B. Inner canthus to the inner canthus. You would wash from the inner canthus of the eye near the nose to the outer canthus of the eye. This is done because you are moving from the cleanest area of the eye to the dirtiest part of the eye. The nares are the nasal passages. 7. Your patient had a stroke, or CVA, 5 years ago. The resident still has right-sided weakness. You are ready to transfer the resident from the bed to the wheelchair. The wheelchair should be positioned at the underscore. A. Head of the bed on the patient's right side. B. Head of the bed on the patient's left side. C. Bottom of the bed on the patient's right side. D. Bottom of the bed on the patient's left side. Correct answer, B. Head of the bed on the patient's left side. The wheelchair should be positioned at the head on the bed on the resident's left side so the resident can assist with the transfer with their stronger left side. 8. You are getting the patient ready to eat. The patient is on complete bed rest. You will put the head of the bed up at underscore degrees or more. A. 10. B. 15. C. 20. D. 30. Correct answer, D. 30. The head of the bed should be up at a 30-degree angle or more. This will prevent choking and aspiration of food while the patient is eating. 9. Your patient has shortness of breath. You should position the patient in the underscore position. A. Prone. B. Left lateral. C. Right lateral. D. Fowlers. Correct answer, D. Fowlers. The patient should be placed in the Fowler's position. The Fowler's position is having the patient on their back with the head of the bed at a 45-degree angle. This position drops the patient's diaphragm, increases chest expansion and helps the person's shortness of breath and dyspnea, difficulty breathing. 10. The Sims position is most similar to the underscore position. A. Prone. B. Lateral. C. Supine. D. Fowlers. Correct answer, B. Lateral. The Sims position is most similar to the lateral position. The patient is on their side for both. It is the position of the arms and legs that differ. 11. You take an adult's blood pressure and it is 40/20. You place the patient in a Trendelenburg position before rechecking the blood pressure. You will underscore to put the patient into the Trendelenburg position. Lower the head of the bed and raise the foot of the bed. B. Raise the head of the bed up to about 60 to 75 degrees. C. Raise the head of the bed up to about 75 to 90 degrees. D. Raise the side rails and place the bed in the high position. Correct answer, A. Lower the head of the bed and raise the foot of the bed. The Trendelenburg position is used for low blood pressure. This position involves raising the foot of bed and lowering the head of the bed so the blood pressure will rise. 12. A nurse realizes after a patient has left the office that she forgot to put the patient's complaint of a sore throat. Which of the following choices would best correct her error? A. Pull out that page of the chart and rewrite it with the correct information. B. Put one line through the original chief complaint, write, error, your initials and today's date. Make the correction by rewriting the CC with the correct information. C. Go to the next available line of the SOAP notes. Write the current date, then, late entry. Place the date and time when the patient stated she had a sore throat. Sign and date the entry. D. All of the above are incorrect. Correct answer, C. Go to the next available line of the SOAP notes. Write the current date, then, late entry. Place the date and time when the patient stated she had a sore throat. Sign and date the entry. When placing additional information into a patient's chart, using the phrase, late entry, will alert the reader that the information was added after the fact and will reduce discrepancies that may result from confusion. 13. Which of the following vital signs can be expected in a child that is febrile? A. Rectal temp of 100.9 degrees Fahrenheit. B. Oral temp of 38 degrees Celsius. C. Axillary temp of 98.6 degrees Fahrenheit. D. All of the above are incorrect. Correct answer, C. Axillary temp of 98.6 degrees Fahrenheit. Afebrile means to be without fever. An axillary temperature is taken in the armpit and is normal at 98.6 degrees Fahrenheit. 14. A patient is having difficulty understanding how to properly run her glucose meter. Which of the following teaching methods would best help the patient understand how to use her instrument correctly? A. Give the patient an instruction booklet and have her call the office if she has questions. B. Tell the patient to have a family member demonstrate how to use the instrument. C. Have the patient watch a video on the use of the instrument. D. Demonstrate the proper use of the instrument and then have the patient perform the process while still in the office. Correct answer, D. Demonstrate the proper use of the instrument and then have the patient perform the process while still in the office. By using a demonstration and performance method of patient education, the patient is offered a chance to perform a task and have learning assessed while still in the office. This ensures that any questions that the patient has can be answered immediately and any performance issues that are observed by the medical assistant can also be corrected immediately. 15. When teaching a patient to use the three-point gait technique of crutch use. A. The injured leg moves ahead at the same time as both crutches. B. One crutch moves at a time and then followed by the injured leg. C. Both crutches move ahead at the same time followed by both legs at the same time. D. None of the above are correct. Correct answer, A. The injured leg moves ahead at the same time as both crutches. A three-point gait is used when patients cannot bear total weight on one of the legs. The injured leg will move ahead with both crutches followed by the uninjured leg. 16. A nurse enters a client's room and finds her lying on the floor near the bathroom door. As the nurse provides assistance, the client states, "I thought I could get up on my own." What information must the nurse document in this situation? A statement explaining the condition the client was found in, quoting the client's words about the situation. B. An explanation of how the fall happened and when the physician was notified. C. An account of the conditions of the room that contributed to the client's fall. D. A description of the client's condition and the reasons why she should have had assistance to the bathroom. Correct answer, A. A statement explaining the condition the client was found in, quoting the client's words about the situation. When a fall or injury occurs while under nursing care, the nurse should carefully document the known aspects of the situation, as well as her response to the injury. In this case, the nurse did not actually witness the client falling, but can quote the client's response to the situation. Listing events that potentially caused the fall implies blame on the parties involved and should be avoided. 17. A nurse is performing an end-of-shift count of narcotics kept in the locked cabinet. The narcotic log states there should be 26 oxycodone pills left, but there are only 24 in the drawer. What is the first action of the nurse? A. Perform the count again. B. Contact the pharmacy to determine if the narcotic log is incorrect. C. Check with the last nurse to sign out narcotics from the system. D. Notify the house supervisor that narcotic medications are missing. Correct answer, A. Perform the count again. Before notifying other personnel or filing a report, the nurse should initially perform the count again. If the nurse is the only one checking the narcotic count, there could be a miscount the first time that might require a repeated calculation. 18. Which of the following is an example of whistleblowing? A. A nurse contacts administration about a colleague who takes supplies to use for a mission trip. B. A client sues a nurse because she failed to call the physician about his wound infection. C. A nursing assistant calls for help when a client falls out of bed. D. A client developed a sacral pressure ulcer when he was not turned in bed for over 4 hours. Correct answer, A. A nurse contacts administration about a colleague who takes supplies to use for a mission trip. Whistleblowing involves notifying administration or a supervisor about activities taking place that are unethical or illegal. Nurses who act as whistleblowers may be reluctant to speak up because of fear of reproach from colleagues or the consequences of their actions on the person acting unjustly. 19. A teacher brings a 5-year-old child to the school nurse because of a bruise under her eye. When asked about the bruise, the child responds, "My daddy did it." What is the nurse's initial action in this situation? A. Allow the child to return to class and monitor for future events that are suggestive of abuse. B. Call the parent and request an explanation for the bruises. C. Call the police and ask for a warrant for the parent's arrest. D. Notify the school administrator. Correct answer, D. Notify the school administrator. When faced with a potentially abusive situation in the school setting, the school nurse's initial response is to contact her supervisor, such as the principal or school administrator. Together, the nurse and administrator can contact the appropriate authorities to properly report the findings based on state requirements. 20. Which of the following accurately reflects the order of discharge/relocation under the criteria for discharge/relocation of patients? A. Ambulatory patients that require minimal care are discharged last because they need the least amount of care. B. Patients that require assistance are after more unstable patients. C. Patients who are unstable are discharged first because resources cannot be spent on unstable patients. D. Patients who are ambulatory and require minimal care must be discharged/relocated first. Correct answer, D. Patients who are ambulatory and require minimal care must be discharged/relocated first. Patients who are ambulatory and require minimal care are discharged/relocated first. Secondly, patients who require assistance are discharged and plans for their care elsewhere are made. Lastly, patients who are unstable are not discharged unless they are in danger. 21. OSHA has very strict standards for hospital employees who may encounter hazardous materials or patients who have been exposed to them. These regulations include all of the following except: A. Respiratory protection must be provided to all employees who might be exposed. B. Training on respiratory protection must be provided. C. Employers must provide personal protective equipment to all employees. D. All ED personnel must be trained in decontamination procedures. Correct answer, D. All ED personnel must be trained in decontamination procedures. All ED personnel should have first responder awareness of hazmat situations but may or may not be trained in decontamination procedures. However, any ED employee who will be participating in decontamination must be trained in the process. 22. Which of the following screening tools have been found to have a high diagnostic accuracy for screening for intimate partner violence? A. Hurt, insult, threaten and scream, hits. B. Humiliation, afraid, rape, and kick, hark. C. Slapped, threatened and thrown, stat. D. All the above. Correct answer, D. All the above. According to the National Preventive Services Task Force, these 3 screening tools have been shown to have high diagnostic capability to show current or recent intimate partner violence. The partner violence screen may have value in predicting future intimate partner violence. 23. A family member is complaining that the lights are too dim in the middle of the night when she comes in to visit her husband. What is the most objective response? A. Patients sleep better with the lights dimmed. B. The night shift nurses prefer to work with less light. C. It's time for him to sleep, and you should, too. D. There's a reason we do that. Let me share a research study with you. Correct answer, D. There's a reason we do that. Let me share a research study with you. Providing the results of a research study with the patient's wife may help her to understand that the unit is operating from the principle of evidence-based practice. This knowledge may help put her mind at ease and help to assure her that her husband is getting the most appropriate care possible. 24. What is a key principle of patient teaching that must take place to ensure patient safety? A. Family members should be present. B. Teaching must be documented. C. Understanding must be confirmed. D. Teaching should be provided by multiple staff members. Correct answer: C. Understanding must be confirmed. A key principle of patient teaching that ensures patient safety is confirmation of understanding. This can be done by asking the patient to repeat the understanding of the information that has been given, and if a procedure, by asking for a return demonstration. Patient understanding should be appropriately documented as part of the teaching record. 25. A nurse is assessing a client's pulse oximetry on the surgical unit. As part of routine interventions, the nurse turns off the exam light over the client's bed. Which of the following best describes the rationale for this intervention? A. External light sources may cause falsely high oximetry values. B. A bright light in the client's face may cause a low pulse oximetry. C. External light sources may cause falsely low oximetry values. D. The client needs a dark and quiet room to recover and maintain proper oxygenation. Correct answer: A. External light sources may cause falsely high oximetry values. When assessing a client's pulse oximetry values, the nurse should turn off any extra environmental lights that are unnecessary, including exam lights or overbed lights. External light sources may cause falsely high oximetry values when the extra light binds to the sensor of the oximeter. 26. Which of the following conditions increases a client's risk of aspiration of stomach contents? A. A client has a scaphoid abdomen. B. A client is in restraints. C. A client is lying prone. D. Both B and C. Correct answer: B. A client is in restraints. Some clients may be at higher risk of aspiration of gastric stomach contents into the airways, placing them at risk of pneumonia. A client who is in restraints may be unable to use his hands to help himself turn or move if he begins to vomit. Other situations that increase risk of aspiration include a client with a full and rounded abdomen and a client that is lying flat and supine. 27. Hepatitis C virus, HCV, can be spread through hugging, sneezing, coughing, sharing eating utensils and other forms of casual contact. A. True. B. False. Correct answer: B. False. False. HCV is spread by direct contact with human blood through blood transfusions, improperly sterilized needles and syringes, needle sharing, or occasionally through sexual contact. 28. The primary route of transmission of NCLEX is via A. Shared needles. B. Hands of healthcare workers. C. Items in the healthcare environment. D. Blood transfusions. Correct answer: B. Hands of healthcare workers. It is well documented that the primary route of transmission of NCLEX is via unwashed hands of healthcare workers who carry the Staph aureus organism from one patient to another. 29. You will be escorting a patient to the operating room on a stretcher. In order to prevent this patient from falling, you must do which of the following? A. Make sure the locks are not locked as you move the patient onto the stretcher from the bed. B. Use a safety belt or strap on the patient throughout their escort to the operating room. C. Put the bed in low position as you move the patient onto the stretcher from the bed. D. All of the above. Correct answer: B. Use a safety belt or strap on the patient throughout their escort to the operating room. A nurse must place a safety belt or strap on the patient throughout their escort to the operating room in order to prevent the patient from falling. This type of safety belt is not treated as a restraint because it is a routine part of care when using a stretcher. The bed must be in the high position so it is level with the stretcher when you are moving the patient from the bed to the stretcher. It is very important that you lock the wheels of a stretcher and a wheelchair before you transfer a patient into or onto it. Falls occur when a nurse fails to lock these pieces of equipment. 30. All hospitals and nursing homes are mandated to have the goal of a restraint-free environment. The best way to achieve this goal is to underscore: A. Ban the use of all restraints under all circumstances. B. Limit restraints to only those situations when falls cannot be prevented. C. Keep all bedside rails up for all patients during the nighttime hours. D. Use no skid socks and sheets to prevent falls from chairs. Correct answer: B. Limit restraints to only those situations when falls cannot be prevented. All hospitals and nursing homes are mandated by JCAHO and state departments of health to have the goal of a restraint-free environment. This does not mean that no restraints can ever be used under any circumstances. It means that all healthcare facilities must have this as a goal. In order to move toward the goal of a restraint-free environment, restraints should be used only when all preventive measures have failed and the patient is in danger of injury. When a restraint is necessary, the hospital or nursing home must use the restraint that is least restrictive to the patient but can also prevent injuries. 31. Which of these devices is considered a protective device, rather than a restraint? A. A mitten on the hands to prevent scratching. B. A mitten on the hands so the person cannot pull their fore out. C. A side rail to prevent the patient from falling. D. A soft wrist restraint to prevent the patient from pulling their fore tubing. Correct answer: A. A mitten on the hands to prevent scratching. Hand mittens to prevent scratching are considered a protective device and not a restraint. However, when the same mittens are used to prevent a person from pulling their fore out, it is considered a restraint. The same is true for the side rail and the soft wrist restraint. 32. Restraints are sometimes used for what patient conditions or situations? A. Punishment when the patient is uncontrollable. B. To prevent the patient from pulling their fore out. C. When a patient is a danger to self and others. D. All of the above. E. Both B and C only. Correct answer: E. Both B and C only. Restraints are sometimes used to prevent a patient from pulling their fore, or another life-saving tube, out and when the person is a serious danger to themselves and or others. Restraints are never used for punishment. 33. The chain of infection includes the underscore: A. Germ, agent, reservoir, exit portal, mode of transmission, entry port, and susceptible host. B. Active natural, active artificial, passive natural and passive artificial. C. Opportunism, weakness, immunity, and colonization. D. Intrinsic, extrinsic, internal and external transmission. Correct answer: A. Germ, agent, reservoir, exit portal, mode of transmission, entry port, and susceptible host. The chain, or cycle, of infection includes the germ, or microorganism, the reservoir, the exit portal, the mode of transmission, the entry port, and the susceptible host. The types of immunity, not the chain of infection, include active natural immunity, active artificial immunity, passive natural immunity, and passive artificial immunity. It is important to learn the cycle, or chain, of infection so you can stop the spread of infection by breaking one or more of these chains. For example, you will break the chain of infection when you stop the mode of transmission by washing your hands. 34. Asepsis is defined as underscore: A. The absence of all microorganisms. B. The absence of disease-causing germs. C. A urinary infection. D. A pathogenic infection. Correct answer: B. The absence of disease-causing germs. Asepsis is defined as the absence of disease-causing germs. It is surgical asepsis that is defined as the absence of all microorganisms, including spores. A pathogenic infection is an invasion of the body by a pathogen, or disease, or germ, and a urinary infection is only one type of infection. 35. Mary T. was admitted to a nursing home on May 1. On July 4, she was diagnosed with a skin infection. This infection is considered a _ infection. A. Nosocomial. B. Systemic. C. Resident flora. D. Resident aura. Correct answer, A. Nosocomial. This infection is considered a nosocomial infection. A nosocomial infection is defined as one that is not present upon admission to a healthcare admission, but instead occurs during the time that the patient or resident is in the hospital or nursing home. Nosocomial infections are a major problem within our hospitals, nursing homes, and other healthcare facilities. Infection control procedures aim to prevent and stop the spread of nosocomial infections. 36. Alzheimer's disease patients wander. The dangers associated with this wandering can be prevented with which of the following? A. Bed alarms. B. Chair alarms. C. Door alarms. D. All of the above. Correct answer, D. All of the above. Bed alarms, chair alarms, and door alarms that ring when a wandering person tries to leave the building help to keep patients safe. Listen for and respond to alarms immediately. 37. Mr. S has just been diagnosed with active tuberculosis. Which of the following nursing interventions should the nurse perform to prevent transmission to others? A. Begin drug therapy within 72 hours of diagnosis. B. Place the client in a positive pressure room. C. Initiate standard precautions. D. Place the client in a negative pressure room. Correct answer, D. Place the client in a negative pressure room. A client diagnosed with active tuberculosis should be placed in isolation in a negative pressure room to prevent transmission of infection to others. A negative pressure room exhausts air to the outside and receives air from surrounding areas, preventing tuberculin particles from traveling through the ventilation system to infect others. 38. Which of the following is an example of client handling equipment? A. Wheelchair. B. Height adjustable bed. C. Shower chair. D. Call light. Correct answer, B. Height adjustable bed. Client handling equipment is designed to reduce the stress and workload on nurses who must assist, turn, or lift clients. This equipment decreases the risk of injuries associated with improper lifting. A height-adjustable bed raises the client up to a proper working height for the nurse who must provide assistance. 39. Which practice will help to reduce the risk of a needle stick injury? A. Only expose the end of the needle once ready to enter the room for the procedure. B. Always place the cap back on a needle after it has been used. C. Keep a sharps container nearby where it can be easily accessed. D. Pass needles between nurses by using the handover technique. Correct answer, C. Keep a sharps container nearby where it can be easily accessed. When administering an injection or using sharps for a procedure, the nurse can minimize safety risks by keeping a sharps container nearby. This provides easy access for quick disposal to prevent the possibility of a needle stick. Needles should never be recapped after use, and nurses should always exchange needles from a central area rather than passing them between workers. 40. Which of the following actions can a nurse do to prevent a fire from occurring in the area where he works? A. Use an adapter when plugging in client equipment. B. Mark equipment that is not working properly and use carefully until it can be inspected by maintenance. C. Notify visitors or post signs that state oxygen is in use in certain areas. D. Keep extra equipment stored in one area with other supplies and materials. Correct answer, C. Notify visitors or post signs that state oxygen is in use in certain areas. Because oxygen is a combustible material, clients, workers, and visitors to the healthcare facility should be aware of its use. All people should be reminded of the consequences of improper oxygen use through signs or pictures that depict this risk. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channels for more resources.